cardiovascular disease and manage diabetes. Research on the new weight loss drug shows they may also help with many other conditions. But at what risk? On our town hall, Revolution or Risk, exploring the new weight loss drugs, we take an in-depth look at the impact these medications are having and explore some of the potentially serious side effects. That's next.
Thank you to the Eunice Joyce Gardner Charitable Foundation for its leadership support of the Health Channel.
Welcome to Revolution or Risk, exploring the new weight loss drugs. I'm Olga Villaverde, and with me is Dr. Michael Zinner. He is the CEO and Executive Medical Director of Miami Cancer Institute.
You know, Olga, I've been studying these weight loss medications for many years. There's a lot we know, and yet there's so much we're learning about them, such as the indications, side effects, and long-term effects of these medications.
But you know, Dr. Zinner, there is a lot of enthusiasm out there because of the weight loss people are experiencing. But take a look at this graphic. It's estimated that nearly 1 in 5 adults is overweight, and more than 2 in 5 are considered clinically obese. And it's not just adults. According to the CDC, approximately 1 in 5 children and adolescents are considered obese.
It's not surprising there's so much excitement around these drugs because they hold the promise to help so many people.
However, there are also important questions like, what are they made from and how do they work? Questions we're going to answer today. So let's get started by watching this video, and then we'll meet our panel. Take a look.
Living Minute, a look at the latest medical innovations changing our lives.
Researchers were looking for a better drug to fight diabetes. What they discovered was a medication that could work for those struggling with diabetes and obesity.
It's really changed how we think about these weight loss medications.
They're FDA-approved for people with obesity and other weight-related conditions, but don't necessarily have diabetes.
These drugs have been shown to help people lose, on average, about 15% of their body weight.
The FDA advises people with a body mass index, or BMI, greater than 30, or a BMI of 27 or more with a weight-related health condition, consider taking them.
I think it's a great tool. I think for a lot of people, it certainly makes a significant difference to how they feel about food and how they feel about their own hunger signals and their ability to control that, and that's very powerful.
The drugs are prescription medications that can be taken either as an injection or tablet.
So there is so much to discuss in this town hall, and I'd like to introduce our panel. First, we start with Dr. Kamaljit Kaur. She is a primary care and lifestyle physician in South Florida. Also joining us, Dr. Jorge Moreno. He is an obesity specialist, internist, and assistant professor at Yale University School of Medicine. I want to thank you so much for joining us on this town hall.
Thank you for having us.
Thank you for having us.
Absolutely.
So, Dr. Kaur, let me start with you. Who are the best candidates for these weight loss drugs, and who should get them?
So that's a wonderful question, because I think that majority of our community believes that these weight loss medications are great options for anybody who has excess body weight to lose. However, that's not always the case. We must consider the person as a whole. What are their other health conditions, if any, that they have? What are the risk factors of them taking these medications, and how effective, if at all, are these medications going to be for them? So the answer isn't so black and white, but it is something that they should talk to their doctor about to really get that personalized recommendation.
And Dr. Moreno, there's a question that so many people want to know. How do these weight loss drugs work? And I know that's not a very simple answer, but break it down for us.
Yeah, well, there's 2 main mechanisms of action, right? One is in the brain and one is in the gut. Sometimes I may refer to the medications as central acting, which is a brain in the brain, and then sometimes they may work in the gut. So the earlier medications really were working in the brain individually and in isolation. Some of the newer drugs actually work both in the periphery and in the brain.
Okay.
So, Dr. Kaur, can you explain some of the research that's been done that led up to these developments?
Yeah, Yes, so some of the research initially, as one of the videos mentioned earlier, was done to find better diabetes medications and maybe even stronger diabetes medications. And one of the, I guess you could say, side effects or other great advantages that they saw of these medications were that they were helping individuals lose weight, even individuals who didn't have diabetes. And I guess that's what sparked even more research and now the newer medications that we have.
I actually have a viewer question. I'd like to take it right now, if you don't mind. And both of you can chime in if you don't mind.
Yeah.
This question comes from Nicole on Instagram. Thank you so much, Nicole. She's asking, have there been long-term studies on the effects of taking these medications? Great question. Dr. Moreno, I'm going to start with you.
Well, so the medications have been around since the 1950s, so it really depends on which medication you were speaking about. Phentermine, for example, was developed in the 1950s, Orlistat or Senecal was developed in the 1990s. So the other thing to consider is a lot of these new GLP-1 medications are associated with some potential side effects, but they have been used in diabetes. GLP-1 medications have been used in diabetes for 20 years. So there's a long history of use in patients with diabetes. So why would it be different for patients with obesity?
And Dr. Kaur, that's such a question that, I mean, it's a great question because so many people want long term. Do I take it? Do I not? What do we know?
Yeah, absolutely. One of the first questions that my patients ask me is, well, how long do I have to be on this medication and what are the side effects of being on it for a long time? And unfortunately, we just don't have the exact amount of information that we would need to give an exact answer. With the research that's going into these medications now, we are having ever-evolving recommendations come out and newer guidelines come out. So it is something that we're staying on top of, but in the beginning, it is something that we touch base with our patients about regularly.
Great stuff. All right, so Dr. Zinner, people overeat for a number of reasons. We know that. Can you explain to us how our body's hunger signals?
So to me, it's very interesting because it starts with the brain and seeing food and hunger, and then you ingest the food, and then it gets to the stomach and the gut, and now we know there's a feedback mechanism that hormones are released from the gut that go up to the brain and they satisfy your hunger. Unfortunately, that's not why everybody eats. And some people eat for satiety. That is, they're looking for other things to reward themselves. Like, we've all seen that. Who's the person who has the fourth cookie or the fifth cookie?
Or the whole bag of Doritos.
Yeah, that's not because they're hungry. It's because they're satisfying something in their brain. And these drugs apparently also work to lower that satiety level.
Dr. Moreno, interesting to follow up with that. I was reading here that there's a term called food noise. Have you heard that, Dr. Zinner?
No.
Food?
So I have to answer what that question is.
Okay, so food noise, what is that?
It's a very interesting term. My patients have been reporting a lot of times that they always have had this thought or intrusive thought about when they want to eat. After their lunch, for example, after their dinner, they're thinking about their next meal. They're thinking about their snack. They're thinking about whether they want to have popcorn between their meals. They want to think about, did I eat enough? Did I have all the calories I needed? Did I follow? So it's these intrusive thoughts that continue. But these medications, the newer medications, have been shown to decrease that food noise and really try to help the patient be able to maintain their weight and also be able to follow the diet that they really want to follow without having those thoughts, those consistent thoughts really continue to pester them almost.
Thank you, doctor. So the FDA has now approved many drugs for weight loss. We have a graphic. Let's show you some of those. And there are a plethora, which you see right there. There are also drugs approved specifically for type 2 diabetes. They are Ozempic and Rybelsus, which we hear a lot of, Dr. Zinner.
So, Dr. Moreno, we're using brand names because, frankly, that's what most people are familiar with, but some of these drugs work very differently than others. Can you explain the difference between the drugs that we've just seen?
Yeah, absolutely. So early on, the medications really were central acting, like phentermine, and they work in the brain to really decrease appetite. They work in an area of the brain which I call the energy central of the brain. It's called the hypothalamus. And that area is really important to understand for viewers to really know that this is the area that these medications target, and they decrease your appetite. Now, the newer medications, the GLP-1 medications that we're going to be talking about, like Ozempic, Zepbound, and those types of medications, they have two mechanisms. They work in the periphery by decreasing your gastric emptying, which is basically slowing down your digestion. keeping you full longer, and then they also work in the brain to decrease your appetite. So they have the twofold mechanism.
All right, and Dr. Kaur, let me follow up. Not everyone who is overweight or obese has type 2 diabetes. What's the link between the two conditions?
So while the research has not yet formally found a particular mechanism of obesity that induces or causes diabetes, some of the theories, I guess you could say, is that one mechanism, when you have extra glucose in the bloodstream, it's just floating around willy-nilly, it needs to be uptaken by certain receptors, say in your liver or in your skeletal muscle, so that it could be turned into good carbohydrate, energy for the brain, energy for the body. We've seen that in patients with obesity, this mechanism is inhibited for some reason that we are still trying to figure out and research. And because of that, that person is left with an excess amount of glucose roaming around in the bloodstream, and then that can wreak havoc on so many parts of your physiology.
I'd like to, if I can add.
Of course.
There's also an underlying mechanism of inflammation that has been shown in some studies. I think that that's why a lot of these studies have been showing other benefits, like cardiovascular benefits and benefits to the liver, fatty liver disease, because these conditions have an underlying elevated level of inflammation. And so that inflammation is being decreased by these medications. So that's the thought process behind it.
So let me ask you, Dr. Moreno, there's been a shortage of some of these drugs for a while.
Yeah.
And the FDA has approved some use of what's called compounded drugs. Can you explain to our audience what a compounded drug is and why they were approved for use and what we should think about them?
Yes, so whenever there's a shortage of medications, you really have to, the FDA allows for some compounded pharmacies to make these medications, but they don't go over that data. They don't consistently go over that safety data. They don't do the rigorous data that the pharmaceutical companies went through to get these medications approved. So there is the possibility of creating these compounded medications, but the safety parameters on those are not consistent. And so from my perspective, I don't feel that they're a safe medication to use. Actually, right now the FDA is targeting them to be stopped because there is no longer a shortage of these medications.
So if you're saying you don't think they're safe, are they as effective? Would you say to some people, do not go with them? Obviously, always consult with your physician. Dr. Kaur is always saying that as well.
Yeah, no, I think it's really hard to exactly know.
Because a lot of people are using them.
Right. We don't know exactly what's in the compounded medication as a compound. There are some additives in there, so we don't know what those additives are. We don't know what those additives can do to the body because they didn't go through the rigorous FDA approval process. And so I would really proceed with caution, as we were just talking with Dr. Kaur before, really try to proceed with caution and talk to your provider. I personally only prescribe the branded medications that the FDA approved.
So I want to follow up with you, Dr. Kaur, because I think this is a very important topic. We see advertisements on television for drugs that are not FDA approved. Not only that, we see them offered down the street in other places that, again, not FDA approved. Let me ask you, you're in practice. You see those patients all the time. What do you tell them?
So this is something that's I'm very passionate about this. My primary goal is always to optimize my patients' longevity, their quality of life, and their health. And there's safe ways of doing this. There's science-backed and evidence-based ways of doing this. And I am more than happy to help, whether it's hypertension or weight management. So when I talk to my patients and they bring up the concern of, hey doc, I want to lose some extra weight and I want to get on one of these medications, my next question or comment is, sure, let's talk about it. Let's see if you're a candidate. And we will do it safely. We'll start out with some baseline assessments if we have to, and from there we'll see if this is something that's not contraindicated for your health, and we'll proceed from there. I am more than happy to help guide them along that journey. Unfortunately, like you mentioned, there is a lot of compounded medication being prescribed, being sold, and just being provided to patients really willy-nilly out here, and we try to educate our patients as best as we can, but unfortunately sometimes cost is a huge factor. And while what we are prescribing might be the best way to go about it, it's very often cost prohibitive for the patient, and that's really what leads them to find or to search for the compounded medications. So all we can do is continue to educate.
And we're going to talk about cost in just a bit, but I have a viewer question here, and I kind of want to still talk a little bit more about risks, because I just, does the benefit outweigh the risk, Dr. Zinner? Isn't that something that's always asked?
So that's the issue that I want to make sure we get to the audience. Yes, these are expensive drugs. Some of them cost between $200 and $1,200, and that's without insurance. And even with insurance, people are worried about the cost. But I want you to highlight what the risks are to the patient population we're talking about.
Absolutely, absolutely. There are certain situations that not only is it a risk, these medications, are completely contraindicated. For instance, some of them are contraindicated in pregnancy. Some of them, if an individual has a history of thyroid cancer, a history of pancreatitis, or other GI conditions that may not prove to be beneficial, or they actually can worsen with these medications. And then there's there's a whole list of complications and risks that we look out for, but I think that would be probably the top.
Dr. Moreno, I want to get to a viewer question real quick. They didn't put a name. I just want to thank them for chiming in this town hall. This person writes, I'm 15 pounds overweight, but I'm going on vacation. Great. It's the holidays. Can I use these weight loss drugs to stop me from eating too much? See? This is a perfect example of does the benefit outweigh the risk here?
One thing we didn't specifically talk about is the indications, right? Body mass index right now, per the FDA, is the indication for these medications are if you have a body mass index of greater than 27 plus a coexisting condition, which could be diabetes, sleep apnea, those types of conditions. Now, you're also indicated for these medications if you have a body mass index of 30 or above. And those are the types of patients that should be given these medications. Now, in that particular scenario, it would really depend on the patient's BMI. If the patient's BMI is below these thresholds, I don't think it's safe to provide these medications for them. But if they do meet these indications, then we can have a discussion about it and see if it's the right option for them.
I'm going to drill down a little bit more, Dr. Moreno,
Absolutely.
on this one. So how many times have I heard, from someone, I'm getting married in 6 months and I want to lose 15 to 20 pounds. Is it worth me going on these medications for that period of time?
I want to get into my wedding dress. I said it.
You know, I've had these conversations with many patients, and I've told them, this is not, I don't know how the medication is going to react to you, because the studies were done in patients that meet those criteria. So I really, I give them other suggestions. We talk about diet, lifestyle modifications. We talk about exercise, strength training. There's so many options that they could help lose the 10, 15 pounds. But if they're not indicated for them, then I have a tough conversation with them and tell them, unfortunately, you are not indicated for these medications.
Okay. Thank you. I hope this helps. But Dr. Kaur, let me turn to you. There's so many different brands out there. How do you decide which one to prescribe for your patients?
Sure. So as physicians, we always try to practice what we call evidence-based medicine. So we look at the data, we look at the science, and then we look at what is indicated, what is appropriate for our patient. And then we also look at the other part of it, which is the art of medicine. And what we do with our patients, we have to look at the whole patient always. So are they always going to be benefited by what we're recommending? And with all the different medications that are out there, it's the same exact thing. We have to see, is phentermine better for them, or is orlistat better for them, or is tirzepatide better for them? And that's always based on the patient themselves, their current health status, their health risk potential, and what they're really looking for. So we always have to weigh all of that to see which one really is the best. There needs to be more research done when it comes to head-to-head trials as far as comparing all of the medications to each other to really tell which one is scientifically the best. But it's really an art, and sometimes it can be a trial and error of which one is the best for your patient.
Dr. Moreno, something that I hear a lot, and I have a few of my friends that wanted me to ask this question, and I know they're watching, is how much can people expect to lose on these drugs?
Yeah.
And how fast will they see the weight loss? Because I think a lot of people think that within 2 weeks, voila.
Yeah. So a lot of these studies were done over a year time frame. And so a lot of these averages that come out in the data is after a year of being on these medications. That said, you can see early results from these medications about 3 months into the treatment.
So 3 months.
So, and that's the beginning of the weight loss, right? Okay. But the trajectory continues for up to a year, most of these medications. And there was a big divide between about 2014 and 2021. That's really when the big separation of how much weight loss you could lose. Before the first generation medications, you could lose up to 10% of your weight. now with the newer medications since 2021, the GLP-1s like tirzepatide and semaglutide, you can lose 15 to 25% of your weight. So that's a significant amount of weight, and it's reaching bariatric levels of weight loss.
Dr. Kaur, would you like to chime in?
I agree. I think, again, the more research that we're getting, the more that we're finding that these are very effective medications. But the one thing I would want people to know, especially anybody looking to get into a wedding dress anytime soon, is that this is not a quick fix.
Right.
You have to give your body the time. You have to allow your body to do its thing. When you're introducing a new medication, no matter what kind of medication it is, the body takes time to get used to that medication and then to do what it's supposed to do with it. So please be patient and please listen to your physician.
I got a viewer question, Dr. Zinner, from Nancy on Instagram. Thank you so much. She's asking, why are insurance companies making it so difficult for people to get these medications?
Dr. Moreno, I'm going to let you answer that one.
Well, I think that in our society, we still have bias and stigma of obesity. I think that we see it as an aesthetic condition and not as a real chronic disease. Obesity is a chronic and progressive and relapsing disease that can really have very detrimental outcomes in health. And so once insurance companies start to realize that obesity is a real disease, they will start covering these medications. Now, on top of that, these medications are extremely expensive. They're about, like you were mentioning before, $1,200 for these medications. So there's still a hike for these insurance companies to pay. About 30% of them, I think the last number I saw, cover these medications. And right now, Medicare, which is a health insurance program for 65 and up, does not cover these medications in isolation for obesity because there's a clause in the Medicare law that does not allow that to happen. So there's still room to work on, and there's legislation to work on that.
Now I want to turn to side effects, because as with many other medications, even if they're FDA approved, Dr. Zinner, we know people experience side effects. Commonly, these are it. Take a look: nausea, diarrhea, constipation, belly pain, and even some headaches. So Dr. Moreno, besides these, are there any other serious ones that people should know about? And how bad are those? I do have a friend that went on it, and she told me the nausea was a bit excessive for her, and headache. But again, everybody's different.
Everybody's different, and those side effects are most common with GLP-1 medications, which are the newer ones, like Ozempic and Zepbound. And so you can have weight loss, you can have nausea, constipation, and diarrhea, and vomiting sometimes. And I think it's important to follow up with your provider if you're having any side effect, and really have close follow-up with them. There are some rare side effects like pancreatitis, which is less than 1% of patients. If patients have gallbladder disease, they should let their physician know, and that could also be a complication. Again, the rare side effects like gallbladder disorders and pancreatitis are usually cited in the data as a less than 1% complication. So extremely rare complications, but remember, 1% of millions of people taking these medications is a lot of patients.
And Dr. Zinner, I do have a question from a viewer. Her name is Victoria, and she asks long-term side effects. She's looking at long-term.
Yeah, so there are no, I want to equate obesity to diabetes, right? So these medications have been around for diabetes for 20 years. Why do we have this kind of double standard for obesity and diabetes, right? They're both chronic diseases. They're both treated very similarly. But they have these thresholds that they have to be, in obesity, they have to be this perfect threshold, right? Unachievable sometimes. And so I think that if someone with diabetes is on these medications for 20 years and hasn't had a problem and hasn't shown a red flag, which the FDA follows regularly, I don't anticipate these medications are going to have those long-term side effects.
But let me just jump in a second about some of the side effects. So we know that the drugs we're talking about, the GLP-1 and the GIP, are really long-acting drugs from hormones that are natural in the body. One of those drugs, like GLP-1 as well as GIP, slows down the stomach from actually emptying, so people can get nausea and vomiting from it. But it also has another effect. It has an effect called an ileal brake, which slows the intestines from absorbing, which is why some of the patients get constipation and some of them get diarrhea. So then it brings me to my question that if people do experience these side effects, do they have to stop the drugs, or are there other options for them, like changing the dosage, Let me start with Dr. Kaur, but then Dr. Moreno, both answer.
Sure. So with these side effects in mind, and just as a side note, I tell all my patients, when you start a medication, no matter what it is, you're going to get a pamphlet full of side effect potentials and possibilities. But if you experience any new symptom, let your physician let me know right away so we can determine if this is safe to continue or not. And then we look at the degree of that side effect. So are you having nausea on a daily basis? Is it happening, just the first time you took the drug and then it never happened again? And if it's something that's intolerable or physiologically dangerous, then of course we discontinue the medication, and then we wait a couple weeks and decide if we should go back on it, on something else, or just try another treatment for weight management altogether.
Dr. Moreno?
So I agree. I think that we really have to see how the patient responds to the medication and see what side effects they're having. But the data does show that if you're on these medications, after some time, you're going to be able to tolerate them. And many of the studies show that patients that had significant nausea initially, as time went on, the nausea went away and they were able to tolerate the medication. Now, I do have patients where I do have to treat their nausea or treat their constipation while they're developing tolerance to the medication, while they're developing some less side effects. But yeah.
So I just want to make sure I understand that.
Yeah.
So patients on the new drugs, they're adjusting the dosage, and their nausea and vomiting associated with it, or diarrhea associated with it, and we're going to work through that so that they can get the advantage of the drug?
So so the data does support that, to work through it. Of course, if it's severe, we hold on it. If you follow the protocol from the studies, we would have to increase doses every 4 weeks, which I rarely do, because there are side effects, or because the patient is losing a significant amount of weight on the lower dose, so I don't have to go up on the dose. So really, I think that one of the things I tell patients is, this is an average individual. The study shows an average individual. You are not average. You're an individual, you're unique, and I'm going to work through you to see how you do, right? And if you lose a little bit less weight, but you're not having side effects, that's okay with me, because you'll be able to tolerate the medication. The same thing is, if you're losing a ton of weight, just with a low dose, why would I ever increase it?
We have several questions coming in already, and I want to thank our viewers. I mean, this is just a great topic, and people are chiming in. So I'm going to just throw them at you one at a time, and we'll ping pong here. Dr. Zinner, I have one here. Audrey on YouTube. Once an individual begins taking one of these medications, will it be a lifelong event? And then Dr. Kaur, maybe you could take Anna's question. What effect do these medications have on fertility and somebody trying to become fertile?
Let's start with Dr. Moreno, and how long should patients stay on the drug, and what's that effect? And then I do want to hear the answer, though.
As I mentioned before, obesity is a chronic disease, right? So these are long-term medications because there is a biology that we're treating. Whenever someone tries to lose weight, there are hormones preventing them from keeping the weight down. And we are using these medications to mimic some of the natural hormones in our body to stay there longer term, so that you're able to maintain that lower weight threshold. That said, these medications, in certain people, I would say the minority of people, can come off these medications after some time if they're following all the puzzle pieces, diet and exercise, if they're really following the hydration, really looking and doing strength training or exercise, doing all the puzzle pieces plus trying to come off of the medication, then they may be successful in doing so. But right now, the data shows that you would need these medications long-term to treat obesity.
All right, and Dr. Kaur, please, let's get Anna's question about fertility. I heard they can help couples become more fertile. True or false?
So, in the middle, I'm going to say.
Okay.
It's very interesting because when these medications, the GIPs and the GLP-1s, started to be used more and more by our patients, we started to get reports of patients who were having a difficult time conceiving becoming pregnant. And we understood a little bit, and by we I mean our healthcare providers and physicians, we understood a little bit about why this is happening. And to put it simply, when they're losing that excess weight, especially in females, that excess abdominal or central weight, there are hormonal changes that happen in the reproductive hormones that do either help or to eliminate the barriers that were there in terms of conceiving. Now, is there a direct relationship? Now, these medications don't directly make pregnancy happen, but the theories were because the weight is coming off, it's becoming easier to become pregnant.
That makes sense. Dr. Zinner, I just got a question from Juliana on Facebook. Thank you so much. I want to see if you can tackle this one for me. And I'm really loving the involvement with our viewers. It's fantastic. Yes. Have there been any coincidental benefits of using GLP-1 meds such as smoking cessation? Any thoughts there?
So what's so interesting about these drugs is we didn't anticipate what effect they were going to have on the brain. So for example, related to that, we know that these drugs decrease the satiety need for opioid addictive disorders. That's sort of interesting. I wonder how, you think about how the brain's affected by that. Well, it turns out there are receptors in the brain that these drugs affect that lower that need for that. And specifically as it applies to smoking, I'm not aware of that, but let me ask Dr. Moreno. Dr. Moreno, are you aware of any that are directly related to smoking? I know there are some around opioid affective disorders.
Yeah, so there's overall in addiction in general, there has been some data that can support this because you're right, they work in the reward centers of the brain. We talked about the energy central of the brain, but there's also some reward centers in the brain where they're starting to notice that there's more involvement in these medications there. Now, I think that there's going to be more studies that come out with this information. Right now, there's some studies running to evaluate alcohol use. And I will say that people on GLP-1s and GIP that report to me, patients that report to me, the taste of alcohol changes, their cravings for alcohol change, and they go from drinking 2 or 3 cups of glasses of wine to none because they just don't have that craving for them anymore.
Dr. Kaur, have you seen that with your patients, if I may ask?
So not as much, not as strongly, but I also do think that part of this, or part of what I'm seeing in my practice, is that patients are adopting a healthier lifestyle in general.
Makes sense.
So they're already thinking, okay, I need to cut down on my alcohol intake. And then sometimes patients who don't drink that much to begin with, they are having those feelings or those sensations.
So I just want to make sure I understand it. Does that mean if I took this drug, I wouldn't eat that 4th cookie that I was talking about earlier, and that it would change the...
Or that 2nd glass of red wine?
We'd hope so.
All right, Dr. Moreno, I want to turn to this. I was reading this, Dr. Zinner. It's estimated that between 50 and 75% of people who start taking these drugs stop them within a year. And that's according to a research paper published in the Journal of the American Medical Association. Now, the people with the highest odds of stopping were African Americans, Hispanics, males, and Medicare or Medicaid enrollees. Dr. Moreno, surprised by these findings?
No, so I think it's a navigation problem, I think. A lot of times insurance companies cover a couple months, or the patient was able to get a coupon card that is short-lived. And so many times that's one of the problems, that the insurance that they had is temporary, or they change jobs and then they can no longer afford it. So because their new insurance doesn't cover it. So that's one issue. The other issue is that last year, for example, there was a ton of shortages, and there was just not enough of these medications to start anyone on these medications. So I think it's compounded. It was like a perfect storm. As I was alluding to before, 1 in 2 patients will have obesity by 2030, right? So that population is hungry for a solution or wants a solution. And so there's a high demand for these medications, and that's why there's a lot of shortages. So to answer your question, I'm not surprised that that's what's happening. And the last thing I'll add is follow-up. A lot of these patients, they may not go to someone like Dr. Kaur who, follows up on them, or someone like myself who follows up with them. But if they get really close follow-up, they may be having side effects, and then we can help lessen the side effects, minimize the side effects, and really help them through that episode where they may say, I'm done with this medication.
Dr. Kaur, that's a perfect segue. So you're seeing these patients. So what do you see in your practice?
So in my practice, I see all types of patients. Patients who have a BMI of just 26, patients who have a BMI of 40. The central theme always is, though, they want to get healthier, and part of that, or a big part of that, is losing that excess body weight that they have. Now, with more education being given to our patients, whether it's social media or television media, patients are understanding the importance of losing excess weight. And so when they come in, they're coming in for the solution. And because these medications are out there and they're so popular, these are usually the first things that our patients are asking for.
So, you know, Olga, no matter what the reason for discontinuing weight loss medication, gaining weight back after it stops has been a problem.
Yes, it has. And we have a video that focuses on that. Take a look.
Living Minute, a look at the latest medical innovations changing our lives.
Millions of Americans have lost weight using new popular weight loss medications. But what happens when you stop using them?
We just haven't had people on this class of medicines for long enough to know what happens in 5 years, even 3 years, and when might be the right time to withdraw people off these medicines.
One thing that has become clear is that some regain the weight they lost.
If you stop the medication, say, within 6 months of being on it, there's a very high chance for weight regain.
The cause of the weight gain could have something to do with how the drugs work, which is by tricking your brain and stomach into believing you're full.
What the medicine is doing is it's actually changing those appetite signals. But when you don't have that medicine on board, then your body goes back to its default state.
As with any medication, you should talk to your doctor before stopping and discuss lifestyle and diet changes.
So that leads me to this question, Dr. Zinner, which we can pose to our guest. If a person starts gaining weight after stopping, what do they do? Do they go back on the drugs? Is this like a seesaw?
Dr. Kaur?
So it's a great question, and it's probably the top 3 that we get when we start these medications or even bring up these medications with our patients. And I'd like to start by explaining that these medications, as wonderful as they are never just the only answer to weight loss. A weight management program or weight loss journey really should be focused on a holistic approach. And when I say holistic, I mean evidence-based methods of good nutrition, a regular exercise routine, avoiding risky substances, a regular sleep routine, and stress reduction. And that's really the cake of weight management. And then the icing on that cake is these medications. Now, with these medications, the effect lasts as long as you're taking them. Once you stop taking them, it's really going to be dependent on what your base foundation, what that cake of lifestyle measures, is in order to continue with the weight loss and have a healthy outcome. Now, if you want to go back on the medications, for instance, you're doing everything that you should be doing, you're exercising, you're eating healthy and all that stuff, and you decide, hey doc, I want to trial off of these medications, or I'm having side effects, I don't want to continue them. Then we safely discontinue them and we monitor how your body does on its own over the next few weeks or the next few months. And then if a decision is made that, hey, the weight came back, I'm doing everything that I'm supposed to be doing, what do we do next? Well, essentially it's kind of like starting from ground zero. We can either go back to the same medication, or if you had side effects, we'd trial another one, or maybe even think of another route altogether. But it's really dependent on a lot of variables, so a personalized recommendation with your doctor is very important.
Interesting. So, Dr. Moreno, in the video, the doctor mentions that when a person stops taking the medication, the body goes back to their default state.
Yeah.
Please help us understand what is meant by that.
Yeah, so there's a theory in obesity medicine called the set point theory, where basically if someone, for example, weighs 200 pounds and then they lose 20 pounds and now they're 180 pounds, the body the hormones are heightened and they are trying to get the patient back to that original 200 pounds. And it's not the weight on the scale that that's really defended. What's defended is the adiposity. And the adiposity is the fat on organs, not necessarily the fat underneath your skin, not the subcutaneous fat. When someone has obesity, fat develops in the liver, in the pancreas, in the heart, and so that fat is really what is driving that survival, basically, of the fat, right? And that's what the body's thinking. I have to defend this fat mass. But with the medication, we are moving the set point down. And now if that person, for example, is 180 pounds, they can stay at 180 pounds with the lifestyle modifications that Dr. Kaur mentioned.
We are going to shift gears in this town hall and talk about children and adolescents. But before we do that, coincidentally, Dr. Zinner, I got a question from Christina on Facebook. And Dr. Kaur, I find this to be so important to ask. Have they studied for children on these medications?
So with these medications, the initial studies were done mostly on adults. I am not aware of any particular studies that have really put the nail in the ground saying that these are perfect for kids, they're absolutely safe, there's no side effects, et cetera, et cetera. But do we use them for children? In some circumstances, yes.
Dr. Moreno, your thoughts on this?
Yeah, there's some medications that are approved in children. The pediatric guidelines say that the minimum age for considering medications is 12 years old. But it's only certain medications that are approved, and I think that really having a discussion with your pediatrician is number one. But there are some medications, and I'll just add in there that there's also bariatric surgery approval for both adults and children, but in children, it's above age 12 where the conversation can start. But again, it's particularly in children, lifestyle modification can be key there because they may just need some changes. But it also goes back to the family because children depend on family to get their nutrients, to get their food, to get their cooked meals, exercise. So when we talk about children, we talk about what's going on in the family unit.
And we're going to talk about bariatric surgery, Dr. Zinner.
I really do hope we get to that. But as we mentioned earlier, and it's not only adults that we're talking about children with obesity. And too many children are considered obese now, particularly in the adolescent range. So, Olga?
A few years ago, actually, the American Academy of Pediatrics came out with new guidelines for children. Let's take a look at this video and we'll talk about it.
Living Minute, a look at the latest medical innovations changing our lives.
Guidelines from the American Academy of Pediatrics recommend extensive treatments for obese children, including weight loss medications and bariatric surgery. But when should parents consider using these options?
They set very clear parameters for when a child is becoming at risk, and they set very clear parameters for when a certain therapy should be applied.
Those parameters include intensive behavior and lifestyle treatment. For those 12 years old and older, weight loss drugs should be considered for severe obesity. Teens 13 and older should be evaluated for surgery.
When we look at the long-term health effects of obesity, both during childhood and extending into adulthood, I think I would encourage parents just to read more about it, learn more about it, talk with a physician that you trust. It's a tool that we need, and for some children, it's the right choice.
Dr. Moreno, what do parents need to know before they agree to put their children or adolescents on these weight loss drugs?
Yeah, like I was alluding to before, I think that really talking and seeing where the patient is, where the child is, what are their lifestyle modifications that they have done or have not done. If they haven't done that, that should be number one. And if they want to think about doing a medication, they should also consider their coexisting conditions. Unfortunately, more kids are developing diabetes, for example, and so maybe there's two reasons why they may want to be on these medications, right, for diabetes and obesity. So one thing we didn't talk about is BMI indications for kids is very different than adults. There's a percentile, and many of you parents in the audience may know that the percentile is always talked about with the doctors. So whenever there's a percentile greater than the 95th percentile in children, that is obesity for children. And greater than 125th percentile is severe obesity in children. So if your doctor is having these discussions with you and talking to you about your child has these numbers, don't focus on the number, focus on what you could do at home with your child.
So Dr. Kaur, we've used the term BMI multiple times in this discussion. I'm not sure everyone understands what BMI is. Can you explain to our audience what BMI is and why it's important when we consider all of these medications?
And not to mention how we know what our BMI is, right?
Sure. So BMI kind of has, it's a number. Essentially, it comes out as a percentage, and it's a calculation of your body weight and your height, but it doesn't take into account what your body weight is made up of. So if a person is 200 pounds and they weigh 6 feet tall, their BMI can be X, but it doesn't really say, well, is it 200 pounds of fat, or are you somebody who has 200 pounds of muscle? And unfortunately, BMI does not take that into account. So while it is a great starting point to start discussions as far as are you overweight or are you obese, overweight is a BMI of 25 to 30, 30 and above is considered obesity. Then you have class 1, class 2, and then morbid obesity. So there are different levels, but it more goes into the discussion than just BMI, because it really is important to know how much central adiposity, central fat you're carrying, and how much of that is visceral fat.
So to oversimplify for a second, at least the term BMI means a combination of height and weight.
Correct.
Is that correct?
Yeah.
Okay. Okay.
And Dr. Moreno, you had mentioned the bariatric surgery, and I want to touch upon that because the video did it as well. So can you tell us what's involved in that surgery as an adolescent, and what does it do?
Well, so there are two types of main surgeries, the sleeve gastrectomy and the Roux-en-Y surgery. Those surgeries basically decrease the size of the stomach or changes the anatomy a little bit so those surgeries are possible in the child. But I do think that it's really a complicated conversation.
Yes.
That needs to happen with the pediatrician and really assessing whether it's the best choice because it is long term.
Is it permanent?
So sleeve gastrectomy is something that can be converted into something different. If it's Roux-en-Y surgery, it cannot be undone.
Okay.
So just, Dr. Moreno's right. Being a surgeon, I'll tell you, I'm familiar with it. Both of them are permanent to some degree.
Correct.
And they're not minor surgery, they're major surgery under general anesthesia. Now, often patients can go home after a day or even the same day or the next day, but it is major surgery. And until these weight loss drugs came along, that was what we were using, particularly for adolescents with morbid obesity, so that they would not develop the complications later in life. And that takes me to my question for you, Dr. Kaur. Can you tell us some of the health conditions and complications that are associated with obesity and morbid obesity in children and adolescents?
Absolutely. Now, we've all heard the term that, what you do as a child carries with you as an adult, no matter what that habit is. And hopefully it's a healthy habit that we're trying to formulate. But in children who are overweight or who have obesity, there are certain health conditions that are more likely to develop as an adult. In fact, some of them even may develop in their childhood and then carry on into adulthood. And more popular, or one of the most popular ones that we hear about all the time, is insulin resistance, which progresses into diabetes a lot of times. But cardiovascular disease is a really big one too. In fact, we've seen that about 50% of obese children actually have a clinical diagnosis of hypertension. And that's something that's very concerning because, as we know, in adults, hypertension, if not controlled or if it's prolonged, puts a lot of pressure on your heart and the rest of your system and can set you up for a lot of cardiovascular events. There's also been studies that show there's a higher incidence of PCOS or infertility and PCOS, polycystic ovarian syndrome. There's also a higher risk of asthma. And then, there's all the physical things that we talk about, but what we often forget or we often neglect is the emotional portion of it. There's depression, there's anxiety, there's social anxieties that kind of develop as well. So it's really physical and mental, and that's why it's so important to address obesity. And I always encourage my patients, because I see a mother will bring her child in for a rash right away, but they're very hesitant to discuss weight or to discuss being obese because there is a social stigma with it. And I want to encourage parents, especially, that without feeling any kind of blame or shame, because I know that happens, please talk to your pediatrician, please talk to your physician, because at the end of the day, we just want our kids to be healthy.
And Dr. Moreno, I have another, I'm thanking our viewers for sending in their questions. Great question from Andrew. It doesn't have to do with children, but I still think it's very pertinent. I've heard the number of obese adults drop for the first time last year because of these drugs. Is this true? I actually read that too, Dr. Zinner.
So there was a study that showed that we may have reached the peak.
Wow.
I think it's still more more information needs to be followed, right? Because a trend is a trend over years, not one isolated number, right? So I think that there's more to come about that, but I think we definitely have developed a solution that really can potentially curb the obesity trend. And I just wanted to finalize a thought of bariatric surgery. Bariatric surgery, for many of our viewers who have been asking about long-term consequences and side effects, it has the longest track record of all of these options, right? Because it's been done for 20 years, 20 plus years. So I don't want to make it sound like it's a negative or like a last resort, because patients can really benefit from this. And some of the major things to think about is bariatric surgery patients have decreased mortality when they have these surgeries, right? They have improvement in diabetes, remission of diabetes. So it is an important tool that can be used in the right individual. And I think Dr. Kaur and I have been talking about individualizing the treatment. A lot of generalizations can be made, but we can't do that with every single patient. We have to really talk to them and see where they are in their journey.
And I'm so glad you used the word tool, because I think it's important to know that we have a lot of tools that can help us. Yes. And Dr. Zinner, it's clear that weight loss drugs is just not the only answer.
That's right, Olga. People need to change their lifestyles and change some of the things that they're eating when they're taking these drugs.
So let's hear from a dietitian from the Mayo Clinic. Take a look.
Living Minute, a look at the latest medical innovations changing our lives.
You're on weight loss medication and are losing weight, but that doesn't mean you can forget about staying on a good, nutritious diet.
It's really important to focus on your diet even when you're on a weight loss medication, not for the success of the weight loss medication necessarily, but for body composition.
Body composition is the amount of fat, bone, and muscle in your body.
We want to be losing more fat than muscle, which is happening in any weight loss scenario. We want to make sure that you're nourishing your body, that you're hydrated, and that you're minimizing those side effects. So nutrition can play a role in all of those things.
Because one of the ways weight loss drugs work is by keeping food in your stomach longer. Experts say you should plan your meals with the idea of starting with low-calorie foods.
You start dinner with a salad, or why you want the majority of your meal to be fruits and vegetables so that you can get a larger volume and start to feel fuller before you get to some of the higher calorie items in your meal. Get that, hey, I'm feeling satisfied, feeling faster.
So Dr. Kaur, I want to kind of touch upon why it's so important to make sure you're eating the right foods, right portions while on these drugs, and not just that, but talking to a dietitian and maybe a doctor along the way. Yes?
Absolutely. This is one of my favorite topics when it comes to weight management and living a healthy lifestyle. We often forget the impact of healthy foods, and actually even of unhealthy foods. Now, I always preach to my patients, and I try to practice this sometimes too, but if Mother Earth didn't make it, try not to eat it. Anything that's made in a factory, anything that's processed, and there's different levels of processed. You know, if you get a bag of frozen peas that all that's in there is peas, but it's frozen, that's minimally processed. But that bag of Doritos or the bag of Oreos, that is ultra processed foods, and you really, really want to try to avoid that, because all the sugars in it, all the preservatives in it, and the additives in it are really wreaking havoc on your body in so many ways, and they're really negating those effects of weight loss that these medications are trying to have.
So, Dr. Moreno, we talk about dietitians, but are there other health professionals that people on these drugs should consult with and deal with?
Yeah, so definitely a dietitian, talking to your doctor. They can also talk to mental health. Because now people that are losing this weight, they may look at the mirror and still see that old person, right, that had not lost the weight. And so there's a lot of important mental health changes that happen on these medications. So that's somebody else that they should talk to. We also, I also refer to cardiology and sleep medicine if they have chronic conditions that need those specialists as well.
Let's in fact go to one of those. So there are other health conditions beside weight loss that these drugs are FDA approved to treat.
That's right, and one of them is cardiovascular disease. Dr. Moreno, can you touch upon that and just tell us what your thoughts on are that and what we're learning?
Yeah, it's really interesting. So there have been studies that show that could be a 20% decrease in cardiovascular risk for patients that have had a cardiovascular event in the past. For example, if somebody had a heart attack before and now they've survived the heart attack and they're doing well, they can go on these medications and potentially decrease their risk of having another heart attack by 20% or a stroke or any a cardiovascular event. And so this is fantastic. And then just in December, these medications were approved for sleep apnea. So I think that that's something that's really important because that's another indication. And some people that may have been denied insurance coverage for these medications may now find that they could be covered for sleep apnea or cardiovascular risk protection.
You must be a mind reader because, again, another viewer question from Ross. Thank you, Ross. I've had a heart attack. I'm so sorry, Ross. And also have sleep apnea, but I'm not overweight. Should I ask my doctor about taking one of these drugs? Your thoughts?
That's a great question. I think that there's a little nuance to that, and I think that definitely having that discussion with their cardiologist, because I'm thinking they would have a cardiologist and a sleep medicine doctor to really discuss whether that would be a good option for them, and make sure that everything that they are considering all the available options for these patients.
And you know, Dr. Zinner, it seems like every other week we have more updates on these drugs and more benefits coming out.
So, you know, it does seem that way. And Dr. Kaur, I'm just curious your thoughts about some of the other conditions that we're talking about. Are there any other clinical trials that either one of you are aware of that are prognostic of what we're going to see coming in the future around the use of these drugs?
Yeah, so absolutely. So there was a recent study in Nature last week that really showed a really important association with various conditions, and I think it goes back to what I said earlier. It may have to do with inflammation, and I think that's something that will come up later. But think conditions like Alzheimer's disease, conditions like Parkinson's, they may be helped with these medications. More to come.
Thank you so much. This has been an amazing town hall. Dr. Kaur, I just want some final thoughts with you, about 15 seconds.
Yes, absolutely. So I want to encourage patients, no matter what your concerns are, what you see on the internet, what you see on Instagram and TikTok, talk to your physician about your weight management concerns, because they are going to be the best ones to really tell you how to go about it and how to go about it safely.
Great information. Thank you to both of you. And Dr. Zinner, you've studied this for such a long time. Your thoughts?
You know, Olga, these are new and powerful drugs that may affect obesity and the epidemic associated with it and the consequences. But we look forward to more information about their long-term effects as we gather experience and do more research.
Thank you, Dr. Zinner. I want to thank our panel for all the great information, to our viewers for sending in their questions, and of course, Dr. Zinner for co-hosting with me as well. Thank you so much. Thanks for watching.
Thank you to the Eunice Joyce Gardner Charitable Foundation for its leadership support of the Health Channel.